Hello, I will be starting my bed pass validation. I would like to start off by stating the 7 rights, which is right time, right route, right dose, right documentation, right reason, right patient, and right medication. After that, I would like to show that I've completed my med sheets. I have 3 med sheets for the 3 medications that would be administered today. And then I will pull up the MAR, and by pulling up the MAR, I know that my patient's name is Carl Miller, date of birth 08/13/1955. He is allergic to vancomycin. His diagnosis is respiratory infection, active stomach ulcer, hypertension, and bacterial conjunctivitis. I will be administering the 9 o'clock medication for this morning, so I will be focusing on cephalexin, Keflex, 250 milligrams. The dose is 500 milligrams PO BID. Then I have furosemide Lasix, 20 milligrams. The dose is 40 milligrams PO BID. And then lastly, I have gentamicin sulfate, 3 milligrams per milliliter ophthalmic solution. The dose is 1 drop in each eye TID. So after I check the MAR, I will be pulling out his medication, and I will begin with cephalexin Keflex, 250 milligrams. Again, the dose was 500 milligrams PO BID. So my first medicine is cephalexin Keflex, 250 milligram, expires 05/2025. Then I have a second one that's also cephalexin, 250 milligrams, expires 05/2027. Together they make up the dosage for 500 milligrams. Following that, I have furosemide Lasix, 20 milligrams. The dose is 40 milligrams, so I have 1 Lasix for 20 milligrams, and expires 06/2036. I have a second Lasix, 20 milligrams, expiration date 06/2036. Together they make up the dosage for 40 milligrams. Lastly, I have gentamicin sulfate, 3 milligrams per milliliter. The dose is 1 drop in each eye TID. Here I have gentamicin sulfate, 3 milligrams per milliliter, expiration date 05/2027. I also have gathered the supplies necessary for this. I have the 2 cotton balls. I have my little dish here that I will fill with saline to clean their eyes. I also have water to offer the patient, so when they take their oral medication. From here, I will be moving into the patient's room, which I will continue my med pass validation. Okay, ready?
Come in.
Hi, how are you?
I'm good. How are you?
Good. My name is Fabiola Ramirez. I am a student nurse at Elgin Community College. I am here to administer your 9 o'clock medication. Is that okay?
Yeah.
All right. Mr. Miller, is it okay if you state your name and date of birth as I check your wristband?
Carl Miller, 8/13/55.
Okay. Mr. Miller, do you have any allergies?
I'm allergic to vancomycin.
Since your stay here, have you had any other allergies?
No.
Okay, good. Then we can continue. I'm going to conduct another safety check. If you could just give me a few minutes, if that's okay with you.
Yeah, that's fine.
All right, so conducting my second safety check. In my second safety check, I have cephalexin Keflex, 250 milligrams. The dose is 500 milligrams PO BID. I have 1 pill cephalexin, 250 milligrams, expiration date 05/2025. I have a second pill cephalexin Keflex, 250 milligrams, expires 05/2027. I also have furosemide Lasix, 20 milligrams. The dose is 40 milligrams PO BID. I have 1 pill Lasix, 20 milligrams, expiration date 06/2036. I have a second pill Lasix, 20 milligrams, and expiration date 06/2036. Together they make up the dosage of 40 milligrams. And then lastly, I have gentamicin sulfate, 3 milligrams milliliters, 3 milligrams per milliliter. The dose is 1 drop in each eye. Here I have gentamicin sulfate, 3 milligrams per milliliter. The expiration date is 05/2027. And then I will be giving you a tissue this is for any leakage or anything from your eye drops. In case
Okay.
you need it.
Thanks.
Okay. And then lastly, just one more time, if you can give me one more time, I'm going to be conducting my third safety check before opening the medication. And again, I have cephalexin, 250 milligrams. The dose is 500 milligrams POVID. I have cephalexin, 250 milligrams. Expiration date 05/2025. The second pill is cephalexin, 250 milligrams, 05/2027. Together they make the dose of 500 milligrams. And then I have Lasix, which is 20 milligrams. The dose is 40 milligrams POVID. Here I have Lasix 20 milligrams. Expiration date 06/2036. I have a second Lasix 20 milligrams, 06, expiration date 06/2036. Together they make up the dosage of 40 milligrams. And then finally, I have gentamicin sulfate, 3 milligrams milliliter. I have the dose as 1 drop in each eye. Here I have gentamicin sulfate, 3 milligrams per milliliter. Expiration date 05/2027. And then I will mark those off for the 9 o'clocks. Okay. And then I would like to just let you know that your Keflex is for your respiratory infection and you might experience some diarrhea. Your Lasix is for your hypertension, which this morning we took at 144/90. So this will help bring your blood pressure down, but it also does cause dizziness and might have you urinate frequently. So if you need to use the bathroom, please call for assistance. Okay. Do you want them all together at once? Or do you want them separately?
All together is fine.
All together is fine?
Yeah.
Okay. Would you like some water?
Yes, please.
Okay.
Thank you. I will take them like so. Yum.
Okay, if you have any questions?
Nope, I'm
Okay.
good.
All right, and then I will be moving forward to giving you your eye drops.
Okay.
I will begin by cleaning your eyes first. Okay, I have the cotton balls that were rinsed in solution or saline. All right, I have, thank you, I have 1 cotton ball for each eye. Inner, outer, inner, outer. Okay, we'll throw that away. We'll hand sanitize again. That's okay, now I will open the drop bottle. Okay, got it. All right, and then I will place it on the side or upside down to avoid cross-contamination. Put it on my gloves. I would like to remind you that the eye drops could cause some blurry vision. Okay. Switch hands. Sorry, I'm gonna switch hands. Okay. All right, I'm gonna start with your left eye first, and I will also be using your head a little bit for support if that's okay. You could just tilt your head back and then look up for me, please. I will be using this finger to pull down your lower eyelid. Ready? Okay, squeeze. Okay, close your eye. And I'm gonna hold that for 30 to 60 seconds. Now when you do use your tissue, I'm gonna tuck that finger in. Also, I'm gonna do it again. Ready? Pull your lower lid, squeeze, close your eye. Hold that for 30 to 60 seconds. Do not squeeze your eyes. And you can only dab. Okay. Gonna hand sanitize. And then I will close the bottle. How are you feeling?
Feeling great.
Okay, I will come back to check on you in 30 minutes. Do you have any questions or concerns?
No, I'm good. Thank you.
All right, I will give you the call light, and that's all.
Cool. Thank
Okay,
you.
we finished.
Thank you.
Okay.
Thank you.